postural deviation? Postural deviation is the mean alignment of the body segments. Postural deviation can happen with either an increase or decrease of the normal body curves, leading to uneven pressure within the joint surfaces. Ligaments will be under strain. Muscles may need to work harder to hold the body upright, and the pain may occur. Here are the factors that are influencing postural deviation. First is the poor nutrition. Second is improper routinely postures. Third is poor daily habits. Fifth is occupational practices. Sixth, congenital deformities and lack of physical exercises. What are the common deviation among students? Common deviation among students: forward head, rounded shoulder, winch scapulae, kyphosis, lordosis, scoliosis, genu varum, genu valgum, pes planus.
Forward head. The head position is protruding forward ahead of your shoulders. If you were to lean against the wall, the back of your head does not touch the wall. This can cause tension, stiffness, pain in your neck, shoulders, and back. To make matters worse, it also leads to migraine, jaw pain, and arthritis in the cervical spine. So what we're trying to fix is the weak front neck. There are some exercises that we can do to prevent the forward head. Exercise number 1. Head grip. Exercise number 2. Head and shoulder rotation.
Rounded shoulders, typically caused by poor posture habits, muscle imbalance, and focusing too much on certain exercises, such as focus too much on chest strength while neglecting the upper back. Exercise to strengthen your core, upper back, and chest muscles will help you correct rounded shoulders.
Winch scapulae. The position of the shoulder blade in relation to your rib cage, especially as you move your arm, so it's when the shoulder blade wings or pushes back. This way, if you look at it from the side, it's doing this inside border is pushing away from your rib cage. Having a winch scapulae is going to be caused by a weaknesses in the quadratus anterior muscle.
Exercises that can help when you have this kind of postural deviation. Rhomboid stretch. You're going to put your butt onto the wall chest, and you're going to take your hands out in front of your body, and you're going to reach out, keep your butt up anterior tilt to the pelvis there, and reach until you feel the shoulder blade stretching. Levator. Put yourself back up against the wall, shoulders back and down, looking towards that pocket. Use your hand to kind of just reinforce and hold it in that position, and then you're going to raise this arm up.
Good day everyone, so I am going to explain the definition of scoliosis based on my understanding and some of my research. Scoliosis is sideways curvature of the spine that most often is diagnosed in adolescents. Deformities could either be the right single curve C or a compound curve S. In adults, the symptoms of scoliosis are loss of height, tired feeling, weakness, trouble standing up straight, and uneven shoulders. Scoliosis is usually discovered during growth in childhood or adolescence. When it begins after puberty or at our mid-age, it is called the adult idiopathic scoliosis because the curve is discovered after complete skeletal growth. There are two types of treatment in scoliosis: the conservative and surgical treatment. In conservative treatment, you will undergo through observation by a doctor through over-the-counter pain medications and core strengthening exercise to strengthen your abdomen and back. Next is the surgical treatment. This is the last option in treatment because you will take the risk of spinal surgery. If you experience much pain and spinal imbalance, you will go into a surgery treatment. As scoliosis cannot be prevented out, instead you need to keep a regular aerobatic and core strengthening exercise. Thank you.
Genome volume, or what we call knock knees. Knock knees can occur due to the rheumatoid arthritis, degenerative arthritis, trauma, or infections. Genome volume, or what we call knock knees, is a condition in which the knees tilt inward while the ankles remain spaced apart. The condition is slightly more common in girls, though boys can develop it too. Knock knees are usually part of a child's normal growth and development.
Genovarum is known as bow leg, lateral curvature of the leg. Arthritis of the medial compartment of the knee is the main cause of genovarum in adults.
Normal feet. You can see the medial longitudinal arch, but in the flat feet there is no arch, so basically is flat.
Flat foot has no medial arc, prominent navicular bone, and the finger cannot be inserted under the arcs. Solo foot an increased area of weight bearing.
Lordosis. Lower back curves inwards more than it would naturally do. There's an imbalance between the muscles surrounding the pelvic bone. This can be caused by setting too much and not stretching, which shortens the hip flexor. So what we're trying to fix is the tight hip flexor, weak core muscles, and weak glute muscles.
Key poses. You have rounded shoulders. The joints of your collarbone and breastbone are unstable. In order to stabilize this joint, your body recruits the pectoris muscles by bringing the shoulders forward. When your shoulders are constantly pulled forward, the muscles in your back becomes lengthened and weak, and your chest muscles are tight. This can be caused by sitting with a bad posture or hunch or overusing a computer in an extended period of time.
Like,
Kyphoscoliosis. It is observed when the normal curve of the thoracic as well as the lumbar vertebrae increase.